everyone. Dr. Tam and Rocky here again. Today we have an exciting episode where we're talking about knee pain. And knee pain is one of those joints where so many people is affected by it. Actually, between your arms and legs, the knee is the most affected joint that at least I hear. And I think a lot of people agree. What have you heard, Rocky?
Yeah, same thing. So the knee is actually the largest joint in the body and the most easily injured. So especially nowadays, it's actually one of the top causes or one of the top things that interfere with our daily activities and
Mm,
our lives in general,
right,
especially that summer is here. We want to make sure that we can do those activities with our family, right?
right.
Our friends. And 1 out of 4 Americans is suffering from knee pain. Although it's not always easy to know why you have knee pain, it helps to find ways on how we can manage it, right?
Right.
So the first question that I have for you, Dr. Tam, is what are the most common causes of knee pain?
Well, one of the biggest cause of knee pain is the body is inflamed. It's an inflamed joint that causes the pain. Now, sometimes it could be a misalignment of the knee. It could be coming from the hips. It could be coming from the lower back, right? It could be the fact that you actually tore something. You have multiple ligaments in the knee, 4 big ones and other little ones. And you got the kneecap, you have tons of muscles attaching to that area, right? So it's hard to say what it is, what could be the cause. We always look at the joints above and below. We examine the knee and have someone stand there and we look at how are the hips lining up? How is your spine lining? Is your arch collapsing, right? A collapsed arch can
Yeah.
ultimately cause knee problems as well.
Mhm.
So is your bone spurs in there? Is your meniscus torn? You see? So
Yeah.
these are all problems that can stem from that the knee pain can stem from ultimately.
All right. And I think based on what I read, it also goes vice versa, right? Knee pain can cause hip pain, your collapsed arch, and all that. And what are the things that I should do about knee pain?
Um,
What exercises do you recommend if there are
well, first we
any?
have to find out what's the cause of the knee pain. You don't want to just jump into an exercise. Now, say if you just
Right.
recently hurt your knee, maybe you have to ice it first, right? And later on, you might have to put heat on it. Is it because your
Mm-hmm.
muscles are too tight and you have to stretch that? But there's a reason why the muscles are tight. Is it because your pelvis and your lower back is off? That's causing the tight muscles, which is pulling on the knee, ultimately leading to grinding of the cartilage and the knee. And then eventually you cause
Mm-hmm.
it becomes bone on bone, right? So that's something you have to address first. Now, of course, most doctors will say, well, take an anti-inflammatory, lower the inflammation. But
Yeah.
covering up the symptoms is not, absolutely not going to be your answer to any problem, especially knee problems. I mean, of course, there's CBD creams that you can try first. Now, maybe you just knocked it into something, right? Maybe you were gardening and you kneeled down for too long and then it got
Yeah.
inflamed. Maybe we're walking and our knee hit the corner of the bed, but we don't realize it until a day or two later. And
Mhm.
you're not going to sit there and think and ponder, what happened to my knee? Most people are just going to say, I have knee pain, right? Now, if the CBD cream, the creams that you use are no longer working, after 3, 4 weeks, it's still the same. Now it could be an underlying problem. There could be a completely separate problem causing you to have knee pain, and it needs to be addressed.
Right, of course. And what do you have any recommendations as far as exercise is concerned when it comes to knee pain?
Of course, you want to make sure that for a lot of people who are sitting, you have to make sure that your hamstrings are loose. Well, the hamstrings can tighten up. You have to make sure that's loose. You have to make sure that your calf is loose, stretching of your quads, your hip flexors, and also your glutes. So everything from the waist below, you got to make sure those muscles are not working against each other. You see, that's going to be one of the first exercises and stretches. Now, a lot of people, because they're sitting, right? And I recommend having a desk that can go up and down. Okay. So up and down desk, now you're going to prevent tightening of the hamstrings, because your hamstrings, when you stand up, it's able to elongate, right? So strengthening the hamstring, strengthening the glutes, okay? That's ultimately going to help the knee.
Right. And they already invented those tables that are adjustable where you can stand up
Right.
and work.
Right.
Right.
Right. And it can only be better for you.
Right.
Mm-hmm.
Of course. Here's the exciting part,
Mm-hmm.
Dr. Tam. So, I found out some myths about, knee pain,
Right.
and we're going to do a fast talk about this myths. So I want you to let us know what you think about it.
All right.
Okay?
Okay, let's go. Rapid
Ready?
fire. I'm ready.
All right. So the first one is knee pain is always the direct result of a problem in the knee.
No, false.
No,
Because knee pain could
false.
be a problem with the pelvis, the lower back, the muscles, not always with the knee. There are some times where we find, and here's the important tip that people have to know. A lot of the times, when someone has knee pain on the right, the pain, the area that acts actually worse is on the left, and vice versa on x-rays. If you have left knee pain,
That's new.
there's a high probability that your right knee could be worse. Some is 50-50. In our office, it's 50-50. You never know, based on the x-rays, which side the patient's having more pain on. That's because, say you hurt your right knee and the right knee starts becoming painful, right? Well, you initially hurt the right side, so the right side started grinding first. Eventually got so painful, your body started shifting towards the left knee. And you forgot about the right knee. And now the left knee is starting to hurt. And then you're not going to go back to the right knee. So you stay on the left knee. And eventually the left knee becomes so bad, you go to the doctor and doctor, oh my gosh, my left knee hurts so bad. The doctor takes an x-ray, and hopefully a good doctor will take x-rays of both knees and says, ooh, I know your left knee's bad, but did you know your right knee's worse? And 9 times out of 10, they hurt their right knee a long time ago. Okay. Before the left knee ever started bothering them, they hurt their right knee. So no, it's not always because of the knee. It's not always because of the same knee either.
Yeah. All right. Next one. Knee pain is an inevitable part of aging. Oh my gosh.
Not true. I know a lot of older people who may not have knee pain. No, not true. Not inevitable.
Not true.
That's like saying that as we get older, we're just going to get sick. Not true.
Yeah. All right. Running can increase the risk of developing knee osteoarthritis.
Absolutely true. Especially if you are running on hard pavement, that pounding, long distance running, long distance runners, they will jam up their knees.
Oh my gosh.
That's true.
All right. Next one. You need to push through knee pain to get rid of it.
No, I don't believe you should push through any pain. So that's a false statement. Anyone who says no pain, no gain. Like, hey, your athletes do it. Athletes do it because they're getting paid millions of dollars to do it, to perform. Right? A shot of something, a shot of Kool-Aid in the knee, let's just say. Might make them better, but
Right.
is it going to cause it to last, right? No, no way.
Mhm. No way. All right. Now, you should decrease or avoid physical activity if you have knee pain, as it places added pressure on the joints and exacerbates your pain.
Absolutely.
True?
Yeah. If you're inflamed, you should relax a little bit more,
Mhm.
right? Until the inflammation settles in and then start moving again. Because you don't want to, the knee is already weight bearing. You don't need to
Mhm.
put extra weight on the knee to grind it down even further.
All right.
Mm-hmm.
So that's true. Now, next, the best treatment for knee pain is over the counter pain medication.
No, terrible.
No.
You're just covering it up, right?
Right.
Over the counter cannot be the best treatment of anything, you see. And a pill can't be
I
the best
agree.
treatment of anything because the key of the pill is not to treat. The key of the pill is to cover up symptoms.
Hmm. Right.
Symptom masking,
Okay.
right?
So definitely not true.
Not true.
Now, my scan will show exactly what is causing my knee pain.
Well, are you talking about x-rays? Or what scan are we talking
X-rays
about?
or
Yeah, x-rays or some sort of
MRIs.
imaging.
Hmm.
It may
Yep.
not if you only x-ray the knee, it might not show exactly what's causing the knee pain because someone
Hmm.
will have to do an x-ray, an exam, and I always examine and at least take a look at above and below to make sure that nothing else is affecting that area.
Of course. All right. Now, a steroid injection will fix my knee pain. True or
False.
false?
Steroid
All right.
injections is just like a drug that's put into the body, right? It's used to
Mm-hmm.
kill nerve endings and numb the nerve. It does nothing to help support why you're having the knee pain to begin with.
In the first place, right?
Mm-hmm.
Okay. Second to the last one.
Okay.
All meniscus and ligament tears need surgery. True or
Not
false?
necessarily. If it's a complete tear,
Mm-hmm.
then maybe you need it. But if it's partial tear, you don't need it necessarily. The best way to do is to visit an orthopedic doctor and find out if that's
Mm-hmm.
something that you need.
All right. Okay. And the last one is surgery is the best long-term treatment for knee pain.
Well, surgery should be the last treatment for anything,
Mm-hmm.
right? There's so many ways that you can do and help knee pain holistically and have it last, right? And that's what we do.
Right.
Part of what we do is that. Not
Exactly.
necessarily surgery.
Getting your life back with naturally, right?
Naturally. This the key is naturally.
Mm-hmm. All right. Okay. Well, thank you so much, Dr. Tim, for joining us today and giving us the information that you and debunking those myths with us. So, thank you everyone for watching this video, and please like and subscribe.
Great. Thank you so much. Thanks, Saki.
All right. Bye bye.